Hi, everybody. We're about to start an Instagram Live right now with Dr. Sam Saleh from Beverly Hills. He also works here in London, so I thought it would be really nice to chat with him about all things smile, face, teeth, and to get that beautiful glowing smile. I'm sorry we started a little bit late. That is totally my fault, and when he comes on, I will have to apologize again. I just got sidetracked with this gorgeous, beautiful, sunny day and didn't realize the time. So, oh, thank you guys. Hi everybody. Thanks for joining. And I see that he has just joined too. So as soon as I can, I'm going to connect him into the conversation. There we go. I think it's waiting now. Hi.
How are you?
I'm super well. I'm so sorry again. I mean, like, seriously, I'm sorry to everybody who is waiting to listen to you chat. How are you?
I'm very well, thank you. Hope you enjoyed your walk.
I did. I left just as the live was supposed to start. I don't know what I was thinking. I saw the 10:30 on my own post, and that's what registered in my head, so I really apologize.
No, that's quite all right. That's quite all right. I think this moment in time, the interesting thing, the impact that it's had on me is it just puts everything into perspective. So I find that things that potentially bothered me in the past really don't bother me anymore at all. Which is a positive, it just puts everything, there are people who are really unwell right now and things like that. So it does put life into a slightly different pace.
So you actually did a lot of your training here in the UK, and you come here often. So you have a dual practice in Beverly Hills and in London, no?
Yes, I actually, I started my career in England. So I studied at King's College. That's where I got my degree in dentistry. And then I was always out here in the States as a child because my mom's side of the family were living here. So I would come here. I'd really like the weather. I'd like the lifestyle and things like that. So it was something that was in the back of my mind. So after I graduated, I did the conversion exams to be able to practice in both places in the States as well as in the UK. And I continued working in the UK for like 3 or 4 years, and then decided to come out to LA for a year initially. So you know how it is. You come out here, and then a year.
You never go back.
Yeah,
but now you have the split, so.
Yeah, so that came as a result. So then, I got married and I got settled, and then had the kids. And then initially my kids, my eldest kind of talk like me, and she would say water and things like that. And then as she got, then she started saying, then she became very American, and she started saying water and all this kind of stuff. I've got nothing against Americans, obviously, I live here, but still I felt like, I'm not really, like I wasn't able to give, my kids some of what I was used to, growing up in England, which was so lovely. And then, so it kind of it triggered something in my mind, and I was getting a lot of requests on Instagram and things like that. Do you come to London? Do you practice? And I was, and I wasn't really doing any of that. And I wasn't actually coming back to London for a while because it's such a long way away, and we had young kids. And then something clicked. I was like, I need to keep this relationship with my roots, which is where I was raised. And so that's when I decided to start doing the travel. And so for the last 3 or 4 years now, I come to London once a month.
And where do you practice from here?
So I'm on Queen Anne Street.
Okay. And tell us what you do exactly. So for the people who are joining in from my side, what is it that you specialize in? Obviously, I know because I follow you also on Instagram, so you do beautiful work. But and there's that smile. So let's talk about the smile.
So I'm a dentist, but my specialty is in aesthetics, and the type of aesthetic dentistry that I practice, it's facial aesthetic dentistry. So, I think in the past, or an old approach to dentistry, is for the dentist to really just concentrate on the teeth and just really looking at the alignment within just the mouth. But my approach is to take a step back and see how the smile fits within the face. And you'll be so surprised at how, the alignment, the position, the size, the proportions of the teeth can have a huge impact on the face. One of the examples of that, I've done so many of these lives, as guests, and something that a lot of people right now have become very aware of is the fact that they grind their teeth and they clench their teeth in moments of stress, when we're busy, when we're working hard and things like that. And through time, when you do grind your teeth down, when you wear your teeth down, that has a huge impact on the entire face. It can cause, first of all, it can cause asymmetry, because the muscles that you use, so the masseter muscle that's here and here is a very strong, powerful muscle. And as with any muscle in your body, the more you use it, the more you exercise it, the stronger and larger it becomes. So if you imagine every night you're really grinding down, you're really putting a lot of pressure, and you're doing it in an asymmetric format, meaning that one side might be grinding down more than the other, that in itself can cause like more of a rounded side on one side of the face compared to the other because of the hypertrophy of the muscle. And then as a result of grinding the teeth down, these, the back teeth are the support structure of the face, and they really this height of your face, so this is the lower third of your face, it can actually reduce the height of the lower third of the face, which can affect the proportions and the relationships of the face as well. So these are some of the things that I correct, and to create not only an impact within the smile, but actually to bring a whole facial aesthetic outcome as well, which can lead to more of a youthful appearance and things like that. If you think of somebody, back in the day, if you've ever watched somebody take out a denture, I mean, this is an extreme example, but when they take their denture out, everything here collapses and they look so much older. So by wearing the teeth down, you're having a milder effect of that throughout time, and that's kind of one of the things that leads to that aged appearance. So one of the things that we do a lot of is correction of the bite first to give you back the correct vertical dimension, and then of course we can then align the teeth and bring the color back, and and all the things that can get damaged.
How do you rebuild those teeth in the back? I mean, that's actually really important. So I treat a lot of people also just for masseter hypertrophy, with Botox or botulinum toxin, but really important. I'm a grinder. I even hear it in my daughter, who is only 8 years old, 9 years old, and I can see sometimes she grinds her teeth, which I do. I used to wear a mouth guard. I shouldn't say obviously, I should, but I don't anymore. But how do you
You should be wearing your night guard.
I know. I should be doing a lot of things. That's on my list. Maybe I'll start now with coronavirus. But how do you actually, really important to talk about those back teeth, because everyone's always really focused on the front, but in actuality, this part is greatly impacted by the teeth, and I always say that to my patients. So a lot of people come in. I think it also causes, changing, because obviously if you don't have the volume here, just even from your dentition, you get sagging in the lower third part of your face as well. It affects your smile tremendously, and of course the harmony with the different thirds of the face. So I think that's really important. But what do you do for those teeth in the back?
So first, like I said, first of all, it's a matter of recognizing, that has been affected. So that gets picked up as part of the diagnostics that I do when I meet somebody for the first time. So we do a lot of photographs. So by photographing the face and looking at how the jaws and the structures are coming together, I can normally tell just by looking that, there's a discrepancy where one side may be more worn down than the other. Then what I do is that we scan the entire arch. So I'm scanning all the teeth, and then I have a digital model of how the teeth are coming together, and then from there I can really see the analysis. So I can see if the back teeth, if there's more wear on one side compared to the other side, it'll become very apparent on the three-dimensional model. And so from there, that's when I do the design. So that's where I'm designing, how many millimeters or how much of an increase needs to be made in the back. So it's all pre-planned, and then the raise is made in porcelain. So it's basically an additive treatment where it's like a hat of porcelain that would go over the back teeth, and that would restore the vertical dimension in a symmetrical format. So I may sometimes have to add more on one side compared to the other in order to create that balance, because the jaw has now become slightly canted.
And then, so for those back teeth, do you actually have to fit them? So do you take away some of the natural tooth to fit the? Is it a cap? Is it like a cap?
It depends on the scenario. So if it's a virgin tooth that has had no restorations whatsoever, then we can be very conservative. It can literally be an additive procedure where it's like a cap of a porcelain that would then adhesively bond over the natural tooth structure. So that would be the most conservative way of going about it. But as with a lot of patients, throughout the years, they can already have had fillings in the back teeth. They could have already had crowns in the past. So if there's already been restorative work that's been done on those teeth, then of course we'd have to go in, remove the restorative work, and then build the porcelain over the top of that. So that would require some treatment.
And then afterwards, all those patients then wear a mouth guard? I mean, how do you maintain that later on?
We always recommend a night guard. So every patient that comes and sees me following treatment gets a night guard. So I'm a big believer in it because studies have shown that anywhere up to 90% of the adult population do grind their teeth at some point, whether it's due to lack of sleep, anxiety, coronavirus. So these are all things that can cause us to clench and grind our teeth. So by wearing a protective layer of which is effectively what it is, it's the type of night guard that we make. And again, this is based on years of feedback from patients, telling me what they're comfortable with and what they're not comfortable with. In my practice, I found that the thicker, bulkier kind of night guards are harder to be tolerated by patients. Because they say that, a lot of my patients will tell me that they have trouble sleeping anyway, and so introducing something inside of their mouth which is large and cumbersome can make it even harder to go to sleep. So the type of night guard that we use, it's a very thin plastic, similar to the type of plastics that they use in Invisalign. We actually use the same type of plastic. So it's a very thin plastic. And the theory behind it is that basically it's covering all the surfaces of the natural tooth structure. So if you are applying a lot of pressure through the grinding, then you're not actually transmitting those forces directly to the teeth, which can cause damage. And more importantly than that, when you're sleeping, you're not quite aware of how you're coming together. So the worst thing is if you put too much, if you really clamp down too much on just one area, and the biting force isn't distributed evenly throughout the arch form. So by wearing the night guard, you're kind of like, it's making it very hard to give that one or two teeth the brunt of the bite, which is typically what will cause a lot of the damage.
And then when you're done with that, you go to the front. So I always wondered how long you can keep these. I mean, are they implants? Are they veneers? What do you do mainly in front of the front?
Yeah, so for the aesthetic reasons, so, if we're looking to enhance the color of the teeth, if we're looking to enhance the position, if we're looking to enhance the length of the teeth, if there's been wear and things like that, then the typical treatment that we would do is a porcelain veneer. And what that is it's essentially, it's a shell of porcelain that sits over the front of the tooth and wraps around the edge of the tooth, typically requiring minimal preparation of the natural tooth structure. And so the big misconception is that all the teeth get filed down to nubs, and that's absolutely not the case. And it's with those shells of porcelain being bonded onto the natural tooth structure is how we're able to make the aesthetic enhancement.
How long do they last for?
It's a difficult question. I get asked that question all the time. It's a very good one. What we're doing is that we're bonding something that's quite strong. So if the types of porcelains that we work with, and there's a wide variety depending on the particular patient and what their circumstances are, and if they're a grinder or not, and things like that. So you want to be specific in terms of choosing the right material for that particular individual. Once you have that, the porcelains that are made, if I gave you a piece of that porcelain, I gave you a piece of your natural tooth structure, and we sent it to the laboratory, the tensile strength, the compressive strength, they're very similar to natural tooth structure. So what I always try and tell patients is that, it's going into a dynamic place. So your mouth is, it's not like you're buying a vase and you're putting it in a cupboard and you're closing the shelf. You're actually using these teeth to eat and chew and all the rest of it. So if you're cautious with them and you use the normal level of caution that you would with natural tooth structure, you're not opening beer bottles and you're not using your teeth as tools.
I should hope you're not doing that that anyway, but yes.
Then in that circumstance, then you can expect to get a really nice long life out of them. And there really isn't, I would say, it's not like something where I'm telling you, in 10 years you will come back and we will replace them. It's something that's dependent on the case and how you age and how the mouth grows. But quoting things like 10, 15 years is very common within the world of porcelain veneers, which is, it's a really nice lifespan to get out of something that you put into your mouth.
I always wondered, because as you get older, obviously, is there any anesthesia that's involved with this? Do you have to, is it painful? What kind of anesthetic do you use here?
So we would use local anesthetic. So most patients will come in, and the typical number of teeth that we're typically working on in an aesthetic case is the number of teeth that that we show when we smile. Is you could see 5 teeth on either side of the smile. So 10 teeth in the upper arch is the typical number that we work on. So patient would come in. We would anesthetize that area with local anesthetic, so the same anesthetic that you're used to when you go in and have a filling or something like that. The procedure for that many teeth, you're looking to be in the chair 2 times for between 2 to 3 hours. So the first appointment is where I place the temporaries. So we do any preparation that's necessary of the natural tooth structure, and then the patient leaves with the temporary veneers. And what that is, it's an acrylic duplication of what the final porcelain is going to look like. And that, for me and the patient, is highly diagnostic, because one of the main things, and I'm sure with your line of work is the same, is the fear of the unknown. So when people come to you and they want to look better, they still have that worry of, well, what are you going to make me look like? And, is it going to be too long? Is it going to be too short? Is it going to be artificial looking? Is my husband going to like it?
You can tweak it afterwards.
Yeah,
so if you
exactly.
don't love what you have, then you can always
Exactly. And you must. I mean, the temporaries is something that I designed based on all the photographs and, the discussion and getting to know the patient and really understanding what it is that they're looking to achieve. But ultimately, you have to see how it works within the dynamic form of the face, because we're not spending our whole time just in one static moment. We're smiling, there's different expressions, there's different moods of the face, and you want to make sure that the teeth, which can't move, that's static, and everything else in the face is moving around it. You want to make sure that that's being designed accordingly and it works within that patient. And so that's where the temporaries become very diagnostic. So we review that design, we make sure that the patient and everyone else is happy, and then based on what we've agreed on is where we go to the final porcelain. So that's when they come back for another 2 to 3 hour appointment where the temporaries are removed. I first place the porcelain veneers over the teeth. Again, we look at them together. We make sure that we approve the color, the shape, the form, all of that. And then they get bonded. So each individual porcelain veneer gets bonded to each individual tooth. And for most patients, then the veneers just literally feel like it's their own teeth. So it's not a matter of feeling like you have something foreign inside your mouth.
How long are these appointments, these 2 appointments that you have to do? And how far?
So like I said, so for a 10-unit case, if you're doing 10 units, typically those appointments run for 2 to 3 hours, and the gap between the two is between 2 to 4 weeks.
And we have lots of questions. We're going to answer the questions as we go along, but I'll leave time at the end to go through them. So you have a lot of questions on teeth in general. How is this crazy expensive? Like what is the normal cost for having something like that done?
Well, say I'm assuming you say the same thing to your patients. When you're looking to make a change in your face, it's a change that you're making, and it's a change that you want to last for a very long time. So when I'm quoting you, 10, 15 years, that's when this treatment has been done well. It's been thought out, it's been designed correctly, and then there's a whole other element of it as well, is the fabrication of the porcelain. So one of the things I'm very fortunate about is I have my own individual laboratory. So, back in the day or even now, it's typical for a dentist to take these molds and to take this impression, then send it out to a laboratory, and then now, that's a whole separate environment in which the porcelain is created. in my practice, what works well is that these two entities are one. So I'm working directly in association with my ceramist, and that way, the conversation that I have with the patient and the understanding that I have for what this patient wants or what this patient needs to suit their face, I communicate that directly on a daily basis with my ceramist who's working on site with me. And this is, in my opinion, the key to the success in these treatments, because I would say about 50 to 60% of the work that I do is revision work. So it's patients who've had this treatment, who have the veneers, and and they're just not satisfied with the way it looks, or what it's done to their face, or or what it didn't achieve, or things like that. So, to overcome this kind of symbiotic relationship that we have together, I'm able to ensure that the final porcelain really does what it needs to do for that patient. And when you do things at that level, then obviously, you kind of
pay for what you get. Exactly.
Yeah, I was just about to say that. So it's one of those things. So I don't want to be misleading. It is an investment, and I always tell patients, and we've had many cases where, the cost factor, is it's something that has prevented them from moving forward. And I always really strongly recommend that, if you aren't able to do it, then really hold off and wait until you can do it, because as with anything, that we have, there are many things that we have in our lives that, have, a higher cost. Rather than jumping in and just finding something that you could, think is the same for a lower amount, it's better just to hold off and wait and potentially just save for it and do it, a year from now or 2 years from now, than potentially getting yourself into a pickle, because, like I said, there really isn't many shortcuts with what we do, and if you do opt for that, then you can get yourself into a difficult scenario.
And do you have a laboratory here in the UK too, or do you take them back with you to LA and then craft it there, since you're there?
Yes.
I'm assuming you're there most of the time.
So my ceramist, like I said, because the porcelain takes time to be fabricated. So there's many stages that go through the process, and like I said, I'm on top of it. So I'm meeting with my ceramist on a daily basis. The way that I have the London set up currently is that it's crazy, and now that we're doing nothing, it's just, reflecting back kind of like makes you realize, how hard we were working. But once a month, I leave my clinic in London, in LA on a Wednesday. So I do a full day, and I catch a red eye, which gets me into London on Thursday, and I actually start seeing patients on Thursday evening, and I'm doing Thursday evening, Friday, Saturday. And then I'm back on Sunday, and then I'm back to work in LA on Monday. So I do that once.
So much hard work.
Yeah, so I do that once a month. So while I'm there, the laboratory doesn't really need to follow me, because I'm there, treating the patients, doing the diagnostics, either putting in the temporaries or putting in the finals, and then the work is basically done, with me in my laboratory where I am in Beverly Hills.
And then you come back, and then what happens for somebody who's in London if they do decide, like, oh, this is not looking at me now, I feel like, oh, you know what, I am a grinder and one side of my face is lower. But what happens if someone isn't, they're not comfortable with what the temporaries that they've had placed? Is it usually something that they can live with for a few weeks, or is it really, what are the possible things that can happen?
Oh, yeah, so the process in which I work, I don't do volume work. I just don't believe in it. I think at this level, if you're seeing, lots and lots of people, then you can't give this kind of specialized attention, and things can fall between the cracks. So when I'm there, it's all part of the program. So if I see you on Thursday and we're doing the preparation, then I'm seeing you again on Friday and possibly again on Saturday.
Okay.
And that's when we're reviewing to see how well the temporaries look inside of the mouth. And what I implemented way before, everything that's going on right now with Corona is that we do a lot of virtual work. So, a lot of my consultations, since 2-3 years now, are through this modality. So we're doing, a lot of virtual consultations. We do a lot of follow-ups with our patients who live across the world in this format. So, I might see a patient in London who actually lives, in France. So they'll come in and then they have to go back, and then we're doing this. And normally I want to get the patient's feedback a week later, because 24 hours later, after you've had a change made to your face, your eye is still telling you what the change is. It's not necessarily telling you whether you like it or not. It's just telling you that, oh, this tooth is now bigger. So it takes a week for the eye to now be like, oh, I actually like it. It works within my face. Or at that point, if you still feel it's too big, then that's something that, it's something that's subjective and we need to make a change for. So I normally rely on the patient's feedback 1 week later, as opposed to what I'm seeing. I mean, the 24-hour recall is for me because I'm taking a lot of photographs. The patient's no longer numb, so that I can really assess and analyze how things are looking. But to get the patient's feedback, I typically need it a month later. And it's very concierge. A lot of my patients, I have them on WhatsApp. So, I've been getting messages all the time during this period. What should I do? Can I do this? Can I do that? And I enjoy it. And I think it's beneficial for the patients too. Because
it's always nice to have a direct communication with the doctor, no matter what you're doing.
Yeah. And I feel like, it just makes for, a better long-term relationship, because that's really what it is.
And what are the things that can happen? What are the potential risks that can happen for anybody who's considering having something like this done?
Anything that can happen with natural tooth structure can happen to the porcelain. So the porcelain is not immune to breaking. So, God forbid you fall over, you have trauma to the face, the porcelain can break, can fracture. The porcelain can come away from the natural tooth structure. That is an eventuality that can happen. Normally, the way that we design it is that if the force that's coming for the tooth, it's done in a way where it's almost designed for it to fail that way, as opposed to your entire tooth breaking. So usually what would make a porcelain veneer pop off is something that if you had your natural tooth, you may have cracked your natural tooth. So that in a way could potentially be seen as a protective mechanism. One of the big pluses of the porcelain over natural tooth structure is that it doesn't stain over time. So the porcelain has a glaze over the top of it, so it's kind of like your fine china at home. It won't discolor throughout time, but as you and I both know, natural tooth structure, with all the coffees and the teas and and people in London, they're having tea and coffee every 30 minutes.
All the time, yeah, of course.
Those, that with natural tooth structure, because of the porosity, it will absorb a lot of that discoloration throughout time. So your natural teeth will discolor as you age, but the porcelain won't.
The one thing that I can't stand, which you don't do because I've seen so many of your beautiful teeth, is I hate those very big white teeth. Mm-hmm. Like, why does that happen? Is that somebody going and just getting something off the shelf? I mean, I hate to say it like that, but how does that happen? There are a few actors and actresses who have, are known for their teeth, and you think, like, why did they do that? I'm sure they have access to someone like yourself, or, at least to have done more research, but how can they not see that, and how does the doctor, say that that's a good result in the end?
Right, and that's a great question. When you're looking at aesthetics, anything aesthetics, you have to kind of realize that aesthetics in itself is a highly subjective field.
This is true.
And so when a patient comes to see me, obviously they've come for my expertise and they've come for my opinion, but I see my role ultimately to deliver what it is that patient wants, what that patient feels comfortable with, and what that patient's vision of beauty is, or and what they think is aesthetic. So I think the trends for aesthetics, or the general what we think is beautiful or not, has changed over the last decade or so. I think aesthetics is moving into a direction of natural and things that are more that belong within the body. And especially for dentistry, I think, the demand for more of a natural result, the demand for translucency, the demand for colors that are suitable for the skin tone, these are things that we're seeing more and more. But hey, even until today, I have patients who come in and they're like, I want people to know that I've done my teeth, and I want that.
That's true.
I want that
There are
visual.
people, yeah, of course.
And I want them, I want my teeth to be extra white, and I want them to be, this and that. So some of it, is, I hate to discredit my profession, because, I'm really proud of what all my colleagues and what the work is that's out there. Some of it could potentially be, maybe the doctor's not guiding it right, but a lot of times it's, it boils down to what that particular patient wanted, and people change their mind. Again, the redo work that I do, like I mentioned, a lot of patients will go and say, I wanted them this way. This is what I wanted. This is what I told the doctor I wanted, and I wanted them to look this way. But I changed my mind, and now I don't want them to look that way. And so let's redo them. So it's one of those it's one of those scenarios. But the good news is, like I said, I think with everything that's going on, and with social media and a lot of the influencers now, who've had teeth that were potentially too white, they're coming in, they're redoing their veneers, and they're going with more of a natural. So I think the trends will go into more of that natural aesthetic.
So I wanted to ask you, so you say most people do 10. What if you don't normally do like one tooth at a time, or like the tops? Because I feel like if you didn't do both of them, if you've changed the color of your natural tooth with these new, veneers, then with time, obviously, there's going to be a greater discrepancy, because, as you said, the other ones don't stain, the veneers don't stain, the porcelain doesn't stain the same way that our porous teeth do. So how does that work? Do you recommend generally, do you try and have everything done together? Or do you say, if you want to do this, we can do the tops first, but no, you're probably going to come back in, I don't know how many months, years, to probably do the bottoms too?
It's very dependent on the case. So every case is different. Every individual is different. And that's why I said, it's so important to do the work ahead of time in terms of the diagnostics. So there are some people who, when they speak and they smile, they have a very full lower lip, and they're not showing so much of their lower teeth. And if the objective of treatment, let's say, is somebody who's been grinding their teeth down, they have a lot of wear, potentially their issues are more to do with alignment and how the teeth are sitting within the smile, then in a case like that, it could be very feasible just to do the upper teeth that show, and then you could hold off on doing the lowers at that point if it's not something that's very apparent. And as I said, today the trend is to go into more of a natural aesthetic. So the porcelains that we work with are incredibly natural looking. So at most it would look like the upper teeth have been bleached and the lowers, haven't got to that.
Haven't had any of that treatment.
Yeah. So for me, when I'm looking at the porcelain work, so when I'm analyzing and when I'm critiquing my ceramist, I'm always looking for the light reflection of what natural teeth, because in my opinion, if you have yellow teeth but they reflect the light really well, and and they behave like natural teeth, that can sometimes look more beautiful than a dead looking white porcelain tooth, which has none of that, and it's just basically it's white but it has no life to it, because that in the face does not read well. It looks like there's a cardboard, or it looks like there's a piece of paper there. So I spend a lot of time with my ceramists, and sometimes I get on their last nerve, because I'm looking for every single one of those angles. So the way you get that right light reflection is in creation of the porcelain. You want to make sure that you have the right cuts into the surface of the tooth, which will allow the light to bounce off of it and create that appearance, or that natural light reflection that natural teeth have. So again, like when you respect some of those features and when you're making the porcelain along those lines, it's sometimes not necessarily something that you need to do the uppers and the lowers. Now, in a case that a patient specifically requested to go considerably brighter than where they are, and if you have somebody who some people, when they smile, their lower lip retracts down. So they not only show their uppers, but they show a lot of their lower teeth as well. And that's just the anatomy of how the musculature works when they're smiling and when they're talking. A case like that, then yes, I would typically advise up front that, if you do go with this color in the upper arch and we don't do anything in the lower teeth, then it's going to be very obvious that you've had the work done. And that's, one of the main goals of treatment is always to look better. What I love to hear is when patients say, everyone tells me that, I look well, I look like I've been on holiday, but they can't tell that I've had my teeth done. That's my biggest
work, yeah.
Yeah, that's always my biggest reward when I hear that, because that means that it belongs. And not to say that you have to give them back what they had, because who wants to go through all this and go through the process if they're not getting a result? So you want to get the result. But in my opinion, you want the result to be undetectable, meaning that it belongs in the face. As long as it belongs in the face, then people can't really see, well, what is it that's been done, because it belongs so well in the face.
And then what about, do you recommend that people have their teeth straightened before, do you recommend braces, orthodontic work before having this done, or can you actually rectify a lot of things prior? Because obviously, I had braces 100 years ago, but just to move the back teeth, for instance, do you ever have that happen beforehand, or can you kind of work with what's already there?
So with reference to braces, here's the thing. If somebody comes to me and they have gorgeous teeth, so the actual anatomy of the tooth structure is really stunning, and I love the color, and I love the actual shape of the tooth for that person's face, but the only issue is the fact that they're poorly positioned, I would always be the very first to say, go get your teeth straightened, because that would be the most conservative option. Now, not every patient will listen to me at that point, because unfortunately we're living in a world where everybody wants everything yesterday.
Yeah.
And so for some people, it's not an option, about two months ago, it was a perfect example. I had a guy who, his career went in a completely different direction, and he was going to be in front of the camera a lot more, and he's going to be doing interviews and things like that. He had very crooked teeth, and he just absolutely wasn't willing to go through the years of braces. So in those circumstances, you can correct the alignment of the teeth with porcelain veneers if somebody doesn't want to go through that process. If you have a combination case where you send the patient to have braces and then they come and get veneers, I'm always very hesitant about those cases. And the reason being, I'll ask you, do you wear your retainer after you had your braces done?
Your teeth move so much. That's
exactly.
The problem.
So now imagine if with your natural teeth, if your teeth move and now they kind of go from straight to becoming crooked, okay, well, you're back to where you started from. But if you now have veneers and now those are all kind of moving into place, now you've got to go 5 steps. You got to go 5 steps back. So that's where I don't typically like to do the combination. So if like I said, if I love the teeth, if I love the shape, the color and everything, absolutely go ahead and go and do the ortho. And I always tell patients, if you do ortho, just remember that you will then have to be married to your retainer, and there's no divorces and there's no breaking up. You have to be married because it's a lifelong commitment. Once you move teeth, they will always want to shift back. So whether you're going to wear a retainer or have the wire bonded on the back, you've got to do one of those two things. But if that's not if that's not the case, then if the teeth are crooked, I would prefer to correct the alignment, correct the color, correct the shape of the teeth, all with the porcelain on a foundation that I know is not going to move from that spot. I feel that with that, you're going to get a better long-term result, and you're going to have less likelihood of relapse and working on a foundation that's not particularly stable.
And then, I always wondered, this is my own curiosity, but when you prepare the tooth for the veneer, I have seen it where it's been significantly, it looks like it's been shaved off or carved off. I'm not sure what the terminology is. But does that make the root of the tooth weaker for when you're older? I mean, do people who have veneers, are they more likely to need implants later on, or is it really you have the base, so that shouldn't be it? The root is not really affected, so it shouldn't have any impact there.
That's a very good question. If the tooth has been over prepared, so this, that's the tooth, and then below the tooth is the root. So if the natural tooth structure has been over-prepared, so there's too much removal of the natural tooth structure, and then you build the rest of it up with porcelain, that tooth does become weaker. And what you run the risk of is the tooth under the porcelain cracking off, because now you have less of a base attached to the root structure. So again, that's another one of the reasons that you want to be cautious when you move forward, and that's why planning ahead is so important, because if the doctor just literally goes in and willy-nilly shaves all the teeth down and to place the porcelain, it might look beautiful, but that foundation or that tooth structure that's left behind is now more susceptible to fracture. So yes, you do need to be careful with respect to how the tooth structure is prepared to receive the porcelain.
And then what about cavities? Can you still get cavities and things like that when you have and obviously not on the ones that haven't been treated, but on the ones you can't because they've been capped and they have veneers on them?
So again, if you remember with the porcelain, the typical porcelain veneer, it's on the front surface and then it wraps over the edge of the tooth. So the back surface is all your own natural tooth.
It's all your own.
Yeah.
Okay.
So to answer your question, yes, you can still get cavities, because if you don't brush your teeth well, then the bacteria can basically sit in that area and then decompose and create the acid, which can create a hole in the tooth. So oral hygiene is really something that's very important, and I start talking about oral hygiene at the consult appointment. So not once the veneers are in, not any time after that. Right from day one, right on the consult appointment, I want to make sure that we're setting the right foundation, because this is an investment inside of your mouth, and you do want to protect it as you do your natural tooth. So if I meet somebody at a consultation who's coming to me with lots of cavities, with a lot of decay inside of the mouth, if I'm meeting somebody who's come to me with just generalized neglect, then I'm typically going to be not talking so much about the cosmetics and spending that consultation time discussing, why are they in the state that they're in, and how we can work with them in terms of improving their daily oral hygiene routines and giving them the right tools and giving them the right advice so they can keep their mouth healthy and then be able to invest in making things look beautiful. Because if you don't look after the veneers, then it's susceptible to all the same things that could happen to teeth, if you don't look after them. Yeah. The silver lining is, or the good news is, that typically when someone doesn't like the way the teeth look, they don't really care so much. And then once they love them,
yeah, of course.
I sometimes have to say, take it easy. You don't have to brush your teeth 5 times a day. You can just do it.
Can you get gum recession with veneers too?
Yes, because the gum is sitting at the level of the porcelain. So aggressive brushing can cause gum recession. So one of my biggest, again, as part of the consult, one of the first things that I recommend is the Philips Sonicare Diamond toothbrush is my favorite. I am not paid by Philips. I have no financial interest in this. I just believe that it is, in my opinion, one of the best toothbrushes that I've seen. My family uses it. I recommend it to all my patients. And it's got a number of built-in functions that will potentially prevent you from brushing too hard. Because that's the number one thing, especially in the gentlemen. They always, in this corner, so right in the canine and the first premolar and the canine on the first premolar, that's when a lot of people just go for it and really feel like, they feel like they're doing a good job. But what they're effectively doing is brushing away their gums in that area, and that area, and that area. So with the Philips Sonicare, first of all, if you press too hard, the base of the toothbrush will flash. So there's a light that will come on. So that tells you right away, you're pressing too hard. And just the mechanics of the brush is in such a way that it doesn't do the spinning, which can cause the recession. It's more of a pulsation, which I found is better for removing the bacteria from the tooth structure.
Gosh, that's been very, very insightful for me. I learned a lot about teeth. And actually, I learned a lot. It's very important because sometimes I have people who come in, and the last question I wanted to ask you, not last probably, but so as we age, the angle of our mandible changes quite dramatically. How does that impact the veneers that have been placed?
Well, again, I mean, it's a matter of looking at the bite. So, if you remember, I said that this turns into a relationship. So once you get the porcelain work done, and it's a matter of the maintenance, and all my patients, I see them at least once a year, wherever they are in the world, because we want to make sure that the bite, and we want to make sure that the relationships that we've created the porcelain to is maintained. So, if we do the veneers and then throughout time there is wear, or if are any issues going on with the back surfaces of the teeth, which is what I think you're referring to, because as the back surfaces get shorter, or if they do wear down, then we lose this V and it becomes more straight, and that's what closes this area up. But I mean, if I'm meeting somebody who's already had that, I would correct it before placing the veneer, so that we have the correct alignment and we have the best posterior support. And if I meet somebody this is great and all we've done is the front, then I'm monitoring to make sure that there hasn't been changes, which again reverts back to wearing the night guard. That's why it's so important. If any of your followers or anyone watching now is in their 20s, now's the time to really kind of get your night guard and get into the habit of wearing it, so that when you're into your later 30s and 40s and 50s, that's you haven't done the damage to the natural tooth structure.
Is there anything I haven't asked that I should have asked?
I mean, I love what I do, and I could probably sit here talking to you about it all day long. But I think we've given your viewers, a nice insight in terms of what I do and what's possible out there.
Have you done your own teeth? You don't have to answer if you don't want to, but that might give away the answer.
No. I mean, I wish I could. I wish I could stand in front of the mirror. I get that question all the time. But I mean, every female in my family, like my wife, my mother, my mother-in-law, my sister-in-law,
everybody's had them done.
Yeah.
Oh, that's unfortunate. You can't help yourself, but you have great teeth, so you're lucky. You're in the right profession.
Thank you so much. Can I ask you? So you have an American accent.
Yes. So
were you trained?
So I did the reverse of you. So I did all my studies in the U.S. and then I went to here. I moved here because I got married to my husband. And so he was living here, and so I moved here, and I had to do the exact opposite that you did. I was fortunate I didn't actually have to take an exam because I was already board certified in the States and working as a consultant there. So basically I did a little bit more training, and I was fortunate enough to be able to transfer that over. It's not very easy to do either way. Taking an exam is no fun at all, I can say that. So it takes a lot of effort to be able to do that. Wow, I'm scrolling, but there's a lot. I can't remember any off the top of my head, but I did see a few questions. What was the name of your toothbrush again?
So it's not mine. It's Philips. So Philips is the brand, and then the model is the Philips Sonicare Diamond. So that's their latest one, and it's actually one step further than that is the Smart. So the Diamond Smart, and Amazon and all those good places have it. What I like about the Smart function is that the toothbrush will sync with your phone. And so if there are areas within your mouth that you're missing, that's typically the inside, that's typically the inside surfaces of the lower front teeth and also the inside surfaces of the back teeth. It will show up on the app so that you could pay more attention to the areas that you're missing. So your hygienist is going to love me for recommending this toothbrush, because she's going to have an easier time with your cleanings.
Excellent. And someone's asked, can you whiten veneers? If you need to whiten them, you just have to replace them, no?
Yeah, so you can't, the color that you choose for the porcelain is the end color. So there's typically no reason to whiten them.
Yes, I can understand that. And then for international patients, so you have a Doxy or a Zoom or some sort of FaceTime or something like that. So they can call you from anywhere. There are a few people asking how to do that, but
so we have a portal on the website where patients can request a virtual or an in-person consultation, and then once that request comes in, then they reach out to you and they schedule it. and then I'm typically calling out through whatever portal, depending on whether you have an Android or an iPhone, and then we do, something similar to this.
All right. Well, thank you so much. I am looking through just to see if there's anything else. I mean, there were a lot of highs. Hi, everybody. But I'm really very sorry for my tardiness tonight. But I do thank you. Let's see. So what do you recommend? Someone's asked for teeth whitening, hydrogen peroxide versus carbamide peroxide.
So they're both from the same. So the peroxides, basically, any teeth whitening, the basic chemistry or the basic mechanism in which it works is that it's the oxygen molecule. So all the peroxides, oxide is basically means that it has oxygen in it. The oxygen molecule goes into the tooth because of the fact that it's porous, and then it removes the stain molecule from within the natural tooth structure, and that's how you get the whiter appearance. So sometimes patients will come to me and they'll say, oh, I want to do a teeth whitening, I want to go this white, and I want to go this, and so one of the things I have to explain is that the teeth whitening, we don't have that kind of control, because all you're literally doing is you're doing like a deep clean of the natural tooth structure to remove the stain molecules which accumulate throughout the years, like the coffee and the tea and the red wine and things like that. It can't go into your tooth and create a whole new color that was never there. That's just not the science behind it, and that's just not how it works. So with all the teeth whitening agents, that's really what you should be looking for as a realistic result. And depending on the percentage of how much of these, whatever they are, depending on what the percentage is and how much oxygen how many of these oxygen molecules you can get on the tooth, that can kind of give you a guide in terms of how fast of a result that you can get. Not to say that just because you use a low concentration, you can't still achieve that same level of whitening. It just may mean that you need to do it more often. So you may have to do, 20 minutes or an hour every day, as opposed to if you go to the office and sit in the chair for an hour and do like an in-house office whitening.
Thank you so much. I really appreciate your time. You can have the rest of your afternoon. So when are you next? You obviously have no idea when you're next in London, but I'm assuming hopefully by the summertime.
Yes. I mean, we're hoping out here in LA. I mean, it's very hard to say, but we're hoping that the restrictions are going to be lifted. Hopefully by June. That's what I'm hoping for. But it's one of those scenarios. I think life will permanently be different, though. I think the way that you and I are both going to see patients is going to be permanently affected by this. We're obviously going to be implementing much stricter protocols. But it is what it is, and we have to learn from this experience, and moving forward, make sure that we're well equipped to not be affected to the level that we were affected.
I know it's been very dramatic for everybody around the world, so it actually gives me time to do things like Instagram Live, which I had never done prior to this quarantine. So that's actually a little benefit, and I get to connect with fabulous people who are really excellent in what they do. So thank you so much for your time. I
You're
appreciate
so welcome.
it. And maybe I'll see you on this side of the pond next time you're here.
I would love that.
All right. Thank you.